Welcome and thank you for standing by. All lines are in a listen-only mode. Today's conference is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn today's meeting over to Dr. Rich Wolitski. Thank you. You may begin.
Hi, everybody. This is Rich Wolitski. I'm the Director of the Office of HIV/AIDS and Infectious Disease Policy here at HHS. And I have to tell you, we're really pleased and proud to be hosting today's webinar on the effects of HIV treatment and viral suppression on sexual transmission. I mean, this is an amazing time where we have these new data that tell us HIV treatment can dramatically reduce the risk of sexual transmission of HIV. The powerful data and the modeling that's been done to date shows that there isn't a single intervention that's potentially more important than increasing viral suppression for preventing new HIV infections and, of course, protecting the health of people living with HIV. Now, this is an issue that a lot of people have been having a lot of discussions about, been doing a lot of work on all around the country. And today, what we wanted to do was to create a space to give us all some time to talk about the data, what they mean to us personally as people living with HIV, what they mean to us as organizations conducting HIV prevention and care programs, and how we're using these data to change the way we do prevention and care. Now, what I'd like to do is to, first of all, acknowledge that this is not an HHS webinar. We're the sponsor, but this is really a community webinar. The webinar was planned independently by a group of individuals that are shown here on the screen who brought their expertise, their experiences with these issues to pulling together the program here today. I want to acknowledge also, however, that we know that there are a lot of you who've been doing this work, and the people that are on today's webinar only represent the tip of the iceberg of people who've been doing this work all around the country. Now, you can't have somebody from the federal government being on a webinar without there being some kind of disclaimer, and so here's our disclaimer for today's webinar. I just wanted to make really clear that HHS did not play a role in the development of the content for today's webinar. The webinar was planned by the planning group from the community, and the things that people are going to say on today's webinar are their opinions. They haven't been reviewed or vetted by HHS, and it's on them if it's not good. So what I want to also do is kind of just acknowledge that this is an issue where the community has been ahead of the federal government. And we're in a process right now within the federal government of reviewing the information that we're communicating about HIV treatment and viral suppression and its effects on sexual transmission. Our websites don't have consistent information from agency to agency. And recently, there was a high-profile MMWR on reproductive options of pseudodiscordant couples that really didn't have the most up-to-date science in it. There's going to be a correction to that MMWR that's going to be published in a very short period of time. It's just being submitted to the MMWR, I think, today. So look for that. But with that, I want to stop. This is not a federal webinar. We're going to turn it over to the community people now. And I can't be more pleased that we have this great group of moderators who are going to lead us through our discussions today. We have Faison Diallo-Dixon from Sister Love. We have Paul Kawada, Executive Director of NMAC, and Chiami Luckett, the Block Project Coordinator of the Positive Women's Network. So, Paul, I think I'm kicking it to you now.